you for joining us today. I'm here with Sarah Allison, who's a trichologist. Hi, Sarah.
Hello.
Hello. Perhaps you could like to tell us a little bit about what you do before we start talking about hair loss.
Well, as a trichologist, I actually specialise in hair loss in women, actually. So I know that quite often people think about hair loss in men and they forget how many women actually are suffering from it because it's such a taboo subject that it's really kept under wraps. No one really talks about it. So that's my sort of specialism is helping people with hair loss, but in particular with women. So.
It's quite true because we always think about men going bald, but I get quite a lot of emails and we get comments on our various sort of social media channels from women who say they are concerned about either losing their hair or certainly feel their hair's got a lot thinner, is often the
Yes.
phrase that they use. So, I mean, what causes hair loss in women?
Well, there's a number of causes. I would say, in particular, the main causes would be stress or illness or hormones or genetics or maybe medication. So and nutritional deficiencies as well. They're all the big ones that are the causes.
So does it
And
tend to kick in at a certain age or is it just more circumstance rather than age related?
Well, really, it is. It can happen at any age. You know, I see children right through to people in their 90s, but there's really there really isn't an age. But I would say it's a bit more prevalent in around about sort of the 50s, around about the time of the menopause. You can get a lot of those causes that I've just mentioned can become more common because you're more likely to be stressed, you're juggling sort of children and elderly parents and having high-powered jobs, so that's why the stress can be important. But obviously it might also be a time of first getting a debilitating illness as well. Those can occur around about that age. And then the hormonal changes obviously too, and that can come in hand with genetics and often you might be prescribed medications, and medications can sometimes cause hair problems. So, yeah.
So I mean, often I know when I brush my own hair, you get some hairs on your hairbrush. I mean, how much hair loss is normal and how much hair loss is actually signifying that you've got a problem?
Well, that's quite a difficult one to gauge, really, because as you know, you do have to get some shedding as a natural process. You have to shed the old hairs and that they will be replaced. We will shed up to 100 hairs a day. I think most people realise that. But when I would say if you're noticing a change in your shedding, that's when you should really start to see somebody about it. Or if your scalp is a little bit more visible than it was before, or sometimes people forget how your hair can keep you warm. So that often the first sign of hair loss is when they start to notice, oh, I'm a little bit cold on my head now, or a little bit maybe in the summer and a little bit more sunburn or something like that. So.
Yeah, I've never even thought about that. I thought about how it looked, but not necessarily how it might feel. So, I mean, if somebody notices that they are losing hair, should they go straight to a trichologist or should they go and see their GP first?
I would recommend going straight to a trichologist, but obviously make sure they are a member of the Institute of Trichologists and they're properly qualified. And also just make sure they do blood tests because that's very important. If a client comes to see me, when they book a consultation, I always send them off to get blood tests before they come to see me. So when they see me, they have the results and I can analyse those with them. It's very important to see that. But and I'm sure GPs would be quite happy that they went to see a trichologist rather than them first.
So if somebody wants to have a blood test done though, and without before seeing a trichologist, what's the best way to go about that?
It would be very difficult, I think, without a trichologist to know exactly what tests to get done. And I see a lot of people that go to their GPs first, and the GPs will do blood tests even, and not do the right ones. So that's how it is. It's quite tricky.
And then somebody comes and has an appointment with somebody like yourself. What should they expect at that appointment?
Well, I think all trichologists work in different ways. For me, I work very much on a consultation basis. So I spend an hour and a half doing a consultation. It's a very detailed history. And the history taken is very, very important. So some people don't realise how much you can gauge from that. And then an examination, it's a very gentle examination, not like when you go to dermatologists and they do horrible biopsies. Yeah, that's quite painful and yeah. So, very gentle examination, and then I would give a diagnosis and a plan of action from there.
And
Yeah.
typically, would somebody just have one appointment with somebody like yourself, or would they have to have a series of appointments?
Well, for me, I mean, obviously different trichologists may have different ways of working, but I don't really see any point in coming back before 4 months because of the natural hair cycle. You're not going to really notice any difference in your hair. Probably, it will probably take 4 to 6 months. I mean, some people notice differences quite quickly, but I don't think it's much point going back before then. So I would normally say sort of 4 to 6 monthly appointments if necessary. You know, if you feel like you're happy with your hair, then quite often people don't bother coming back, and that's fair enough. But some people like a little bit of reassurance that yes, it is regrowing, or maybe sort of tweaking their advice or treatment plan a little bit more.
And you say you give a treatment plan. Typically, what sort of treatment options are available?
For me, I would say it really does depend on identifying the cause and eliminating the cause. So obviously, people, those causes I mentioned right at the beginning there. So really talking about those different ways of getting those under control, but also nutrition is of paramount importance, and that is important in all of those causes. So making sure people are eating the right diet, skipping any meals, eating protein 3 times a day, that kind of thing. Drinking enough fluid, so drinking about 3 litres of fluid a day, that's really important. But also I do recommend some nutritional supplements as well. So.
And what are the nutrients that perhaps we are lacking in our everyday diet that would be included in the supplements that you would recommend?
Vitamin D is a biggie. Obviously, I know there's been a lot in the media lately about that, and it's something I'm very passionate about. So there's an epidemic of deficiency in this country, but also worldwide too. So even countries that do have sun, people just don't go out in the sun enough, sort of covered up with sunblock or wearing too much clothes, or just the lives that we lead now. Much more office based and less outdoorsy. So a lot of vitamin D deficiency, so that's very important. The hair follicles have vitamin D receptor sites, so that's why it's very important for your hair. But there are lots of other ones too, like biotin and B vitamins and zinc and iron too. Yes. Quite a big list, actually.
It does sound like a long list. I mean, would you say to people they should take separate supplements or take, a composite sort of supplement specifically for hair loss?
Well, I would recommend there is a formulation on which has just been launched very recently, so only a few weeks ago, and it's a formulation I have been working on, which is called Archaea Minerals for hair, skin and nails, and it's really comprehensive. It covers everything you could possibly want, really, apart from unless you were very low in iron and needed some extra iron, but you'd only know that from a blood test. So it's a very good all-rounder for people that haven't had blood tests and need anything very specific. It's very general, but high quality and packed with nutrients. So, yeah.
And are there things that we do that perhaps could be damaging our hair? I'm thinking things, for instance, like colouring our hair. Could that be doing us more harm rather than good, or does it not really matter?
I get asked that question quite a lot. A lot of my clients, obviously, women tend to want to dye their hair, and that's almost like the worst thing you can say to a woman is, no, you have to stop dyeing your hair. So normally, though, I have to say that it's okay to dye your hair because a lot of those causes that I've mentioned before, they're coming from internal rather than from external. Obviously, sometimes you do get cosmetic trauma to your hair where it is over-processed and maybe too much peroxide or too much heat appliance. So in that case, that's breakage at the ends rather than sort of thinning at the scalp.
So are there things that we can do apart from taking supplements? And you've mentioned drinking water. What other things can we do to absolutely maximise the condition of our hair, especially once we're over 50?
Over 50, oh dear. And And I said, apart from de-stressing as well, stress is very, very important. So I would certainly take measures of getting that under control. The proven ways of de-stressing would be sort of massage. You know, it helps to relieve your cortisol hormones. The cortisol hormones build up in your body. That's a damaging thing. So massages, stroking pets, exercising. They're very and nutrients again are very important for stress relief as well, because when you are stressed, it takes a bigger toll on your body, and you need more nutrients at that time. Yeah.
Okay, well that's really, really helpful. I know that we do think of it as being applicable mostly to men, but it is increasingly becoming a problem for women as well, I think.
Yeah, really, it's a huge problem, but it's just that people just don't talk about it. That's all.
So, is there actually? You've mentioned that people don't talk about it. Are there groups there that where people know? Are there sort of like women's hair loss support groups or things that you would recommend,
There
or
is,
not really?
well, there is alopecia. Alopecia UK is a very good support group, but that's often for people that have more severe type of hair loss. But they're very happy to see people of any kind, really. Yes.
Yeah.
So that's
Well, thank you very much for that. Thank you for sharing that. And I'm just presuming if anybody has any questions, you'd be more than happy in the future if we can put some questions together and put them forward.
Yeah, sure, absolutely.
Lovely. Okay, thank you so much, Sarah.
That's all right, pleasure. Bye.
Bye.